Hello everyone, Felicia Wilson here with Care Talk. Today I want to share my thoughts on mental health in older adults. I think we can all agree that the past year, almost a year, has been pretty overwhelming for most people. But did you know that older adults struggle with two primary mental health issues: depression and anxiety? So, in context with what's going on in our world, we can imagine that these numbers have been rising all across our world. I want to talk to you today about what mental health in older adults look like and what you as a caregiver can do to help support them in their mental health and well-being. As I mentioned, one issue is depression and the other is anxiety. A lot of times the term is used co-occurring because we see these two diagnoses together in older adults. Anxiety just means that there's excessive worry or concern, anxiety, for about 6 months. For depression, you have to have a depressed mood, lack of interest or pleasure within the same 2-week period. Now, I don't want to get too clinical and go into all of the details, so that's just a general overview of the time period that you're looking at for depression and anxiety. How do you know if it's really depression and anxiety? There are a couple of scales or assessment tools that anyone could use if you're interested in gauging whether or not there is something to talk to your healthcare or mental health professional about. You could look up, Google the Beck Depression Inventory 2. And it's important that you get the BDI, Beck Depression Inventory 2, because that was designed specifically for older adults. The second one would be the Geriatric Anxiety Scale. Again, both of these have been tested with older adults to make sure that the test is reliable and valid. It's not a hard test to administer. They both have roughly 20-something questions, and the scale is on there to tell you exactly the range that your loved one falls in. If it's something that if the end result is high, like the number is high, then you may want to have a conversation with your primary care physician or contact your local mental health provider. It is important to not overlook depressed moods and anxious behavior, because left untreated could definitely spiral into something significantly worse. We want to make sure to support our seniors, make sure that they are not only physically healthy, but also emotionally and mentally healthy. Let's just say that there's not a clinical issue where you require someone to oversee and help you manage depression or anxiety. You still want to make sure that they are engaged in some activity daily that promotes their well-being. Make sure, if it's nice outside and sunny, to go outside and let them just enjoy being outside. Or create an activity schedule so that they can be engaged throughout the week. What we don't want is for our senior loved ones to sit in a room isolated doing nothing all day. Making sure that they have something to look forward to is really important and can give them a sense of purpose and enjoyment as they just live day to day, just like you would do any other population. We don't want to overlook the importance of making sure our seniors lead quality lives, and that definitely includes making sure they are mentally healthy.